talk about the obesity and comorbidities associated with COVID-19 clinical and laboratory evidence. What are the coronaviruses? Coronaviruses are common virus family known to cause a range of diseases ranging from common colds to severe pneumonia. Coronaviruses include the two types, MERS coronavirus, Middle East respiratory syndrome, and SARS coronavirus, severe acute respiratory syndrome. The COVID-19 is a new coronavirus disease, and the SARS-CoV-2 is the name of the virus that caused COVID-19. COVID-19 chain of infection. This is the chain of infection refers to the interaction between the pathogen, the host, and the environment. It started from the infectious microbe SARS-CoV-2 to the reservoir, which is the place where the virus lives and replicates, like in the people and animals, to the portal of exit, how the virus leaves the reservoir mouth or the nose through coughing, sneezing, or choking. Two modes of transmission from person to person airborne direct contact with the virus in contaminated surface. To the portal of entry, the mucous membrane of the nose and mouth, and to the susceptible host, who is the non-immune person and causing the infectious microbe SARS-CoV-2 and so on. So how does the virus spread? Primarily spreads person to person via respiratory droplets from coughs or sneeze like the flu. Possibly spreads by touching an object or surface with the virus on it, then touching his mouth, nose, or eyes. Possibly spread through stool with the virus in it, and it took approximately 2 to 14 days, median approximately 5 days for an infected person to show symptoms. People likely most infectious while they are most asymptomatic, coughing, sneezing, most symptomatic like coughing and sneezing, also spread from the people without symptoms appears positive. What are the symptoms of the new coronavirus? The most common symptoms include fever, cough, shortness of breath, and difficulty breathing. And the most severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Many studies showed that the clinical presentation of the patient with COVID-19 ranging from the fever, cough, fatigue, shortness of breath, myalgia, arthralgia, headache, nausea, and vomiting, and diarrhea, and it increased these symptoms in severity in the chronic if it's associated with chronic medical illness like hypertension, diabetes, coronary heart disease, abnormal liver function, cerebrovascular disease, COPD, cancer, chronic renal disease, and immune deficiency. Also, many studies and systemic reviews showed the laboratory characteristic of the patient with COVID-19, and all studies found that the most common laboratory characteristic ranging from leukocytosis and leukopenia and lymphopenia associated also with high LDH, ESR elevated, and elevated of the C-reactive protein. Complications of the COVID-19 disease. Complications from the COVID-19 can be severe and fatal. The risk of developing complication increases with age and is greater in those with underlying health conditions. The type of complications that can develop may include the venous thromboembolism, heart, liver, and kidney problems, neurological problems, coagulation like blood clotting, the respiratory failure, multiple organ failure, and septic shock. Now we will talk about on the obesity. What is the obesity? Obesity defined as excessive accumulation of body fat is generally determined by the body mass index BMI, calculated by body weight per kg, divided by the height squared, and the number of the obese people is globally increasing. The BMI categories ranging from the normal weight, it's equal or in between the range between 80.5 to 24.9. Overweight, and it's range from the 25 to 29.9, and obesity, the BMI is equal or greater than 30. As obesity affects adverse health outcomes such as coronary heart disease, artery disease, cerebrovascular disease, insulin resistance, hypertension, and fatty liver disease. Fat accumulation does not only affect the mechanical-related health complications, but abundant adipose tissue also releases many adipokines which play a role in the inflammatory process. Also, the immune system is suppressed in obese people, especially in vulnerable people with multiple comorbidities. The obese people may be more susceptible to SARS-CoV-2 infection. The laboratory consequences of obesity, we will find the high blood glucose, low in HDL, high LDL, elevated cholesterol, high in triglycerides. And in CBC, we found that maybe low hemoglobin showed many types of anemia, elevated liver enzymes, especially ALT and AST, low calcium levels, low serum iron, and vitamin D, B, A, and maybe C. The high serum uric acid, there is also increased crystals and salts in urine, and increased ESR, C-reactive protein, increased inflammatory cytokines, especially tumor necrosis factor, interleukin 6 and interleukin 9, and also there are hormonal changes like the thyroid hormone. Obesity-related diseases like cardiovascular disease, elevated blood glucose level, increase in the blood pressure causing hypertension, osteoarthritis, the accumulation of cholesterol causing the atherosclerosis, and also causing many types of asthma and sleep apnea. So additional morbidity with obesity like chronic lung disease, asthma, and systemic inflammation. Many reports identified obesity as risk factors for hospitalization, mechanical ventilation, and mortality from H1N1 influenza. Obesity increases the duration of the virus shedding of the influenza A virus. Based on currently available information and the clinical expertise, the Centers for Disease Control and Prevention, CDC, has identified severe obesity like BMI equal 40 as a common clinical risk factor for worse prognosis and higher mortality in patients with COVID-19 infection. Furthermore, any degree of obesity, like BMI more or equal to 30, has been associated with poor prognosis in patients with COVID-19. Obesity may induce alteration in the renin-angiotensin-aldosterone system, RAAS, that promotes further derangement in the COVID-19 infection. Adipocytes may substantially contribute to the production of circulating angiotensinogens, which after metabolism by renin and ACE produces angiotensin II. Such obesity may lead to an overactive RAAS. In a study by Liu et al., 28 patients with COVID-19 infection were shown to have elevated angiotensin II levels that correlated with severity of lung injury measured by the PaO2 fraction of inspired oxygen ratio. High angiotensin II levels in the lung can induce pulmonary vasoconstriction, leading to ventilation perfusion mismatch and hypoxemia, as well as inflammation and oxidative damage promoting acute lung injury. COVID-19 penetrates human cells through direct binding with angiotensin converting enzyme 2 receptors on the cell surface. The obese demonstrate insulin resistance and overactivity of the RAAS, which is implicated with worse outcomes in COVID-19 infection. The ACA2 expression in adipose tissue is higher than that in the lung, so a major target organ affected by the COVID-19, suggesting that adipose tissue may be more vulnerable to the COVID-19 infection. In obese individuals with type 2 diabetes mellitus, angiotensin II levels were shown to positively correlate with the body weight. Thus, the elevated baseline of angiotensin II levels in obese may exacerbate COVID-19-induced angiotensin II level increase, leading to more severe lung injury. Interestingly, angiotensin II level decreases the response to dietary weight loss. Obesity is also linked to other numerous risk factors for the chronic heart disease, like is the type 2 diabetes mellitus, high low-density lipoprotein cholesterol levels, triglyceride level, hypertension, and metabolic syndrome. Importantly, the type 2 diabetes and hypertension themselves represent the frequent comorbid condition in patients with COVID-19 infection. The risk for the heart disease coronary heart disease is higher in people with central and visceral obesity. Many studies have demonstrated an increased rate of pneumonia and severe pneumonia in the higher BMI levels. The pathogenesis linked between the obesity and the severe COVID-19 could be immune dysregulation, comorbidities, and an impaired respiratory system. As obesity is related to the immune dysregulation, including elevated inflammation and the impaired host immune response. Fat cells, particularly the visceral adipocytes, can induce macrophages to release interleukin-1, interleukin-6, interleukin-8, interleukin-10, human necrosis factor alpha, C-reactive protein, and resistin. The overproduction of these pro-inflammatory cytokines at the cytokine storm is also a mechanism of the liver-lung injury as well as multi-organ failure in the COVID-19. This diagram shows the relation between the SARS-CoV-2 viral particles to which it is targeting the lung and adipose tissue, also like the action of the obesity which is targeting the adipose tissue, and both sharing in the increased cytokine production, the pro-inflammatory cytokines, and affecting on the immune cell activation, and so the obesity and the viral particles collaborated to causing the organ and tissue dysfunction like the brain, heart, kidney, GIT, peripheral nerve, and the skin by endothelial dysfunction, the microcirculatory dysfunction, or coagulopathy or hypoperfusion. This diagram shows how the obese patients like a reservoir for the COVID-19. Why? That because this person complaining from many factors that causing or act as a risk factors for SARS-CoV-2 or the COVID-19. The obesity causing the cardiometabolic diseases like the hypertension, diabetes, high LDL cholesterol, high triglyceride, low HDL cholesterol, increasing pro-inflammatory cytokines, so increasing inflammation, increasing immune dysfunction, affecting the pulmonary function, heart disease, kidney disease. So all help the COVID-19 to sharing and causing more problems in these patients and increase the comorbidity and severe symptoms affecting the obese patients. This also table this showing the obesity associated comorbid conditions potentially implicated in worsening the prognosis in the patients with coronavirus COVID-19, especially in the endocrine metabolic system like insulin resistance, prediabetes, or dyslipidemia like the hypertriglyceridemia, or autonomic nervous system like the chronic and excessive activation of the sympathetic nerve and renin-angiotensin aldosterone system, as we mentioned before. The affecting the immune system by the chronic inflammatory reaction, also the cardiovascular system by the hypertension, coronary heart disease, pulmonary and sleep apnea, hematological and cancer, and so on. This table showed the baseline characteristic of the patient with COVID-19 and related body mass index or BMI with the clinical symptoms and laboratory symptoms, showing that the more increasing in the BMI more or equal to 25, showing more in the comorbidities as the diabetes, hypertension, and dyslipidemia, and it was found that days of the illness of admission increased, and not that the lymphopenia affected and obvious in this group, also increase in the liver enzyme. The chronic inflammatory state in obese people might be related to more severe inflammation and results in worsened outcome in the COVID-19. On the other hand, obese people are less adept at mounting immune response against the microbes. So, SARS-CoV-2 and superimposed bacteria could infect and replicate more efficiently among these populations. Additionally, patients having underlying medical conditions like serious heart disease or heart conditions, diabetes, chronic kidney disease, etc., might be at higher level or higher risk for severe COVID-19. The greater number of comorbidities in obese patients therefore increases the severity of the COVID-19. The respiratory system is also changed in obese people. Altered respiratory mechanics, increased airway resistance, and decreased lung volume can impair gas exchange. Obesity represents a risk factor for higher severity and worse the prognosis of in patients with COVID-19 infection. Likewise, obesity-induced adipocyte tissue inflammation and its effects the immune system plays a crucial role in the pathogenesis of COVID-19 infection. Moreover, it also results in metabolic dysfunction, which may lead to dyslipidemia, insulin resistance, cardiovascular disease, metabolic syndrome, type 2 diabetes, and hypertension. Obesity in patients with COVID-19 is associated with severe disease, particularly severe pneumonia. The rate of adverse outcome, including AKI and ICU stay, also increase in obese patients with COVID-19. This figure shows how the SARS-CoV-2 or COVID-19 affected on the obese host or obese patients, which is likely present the multiple risk factors causing the bad prognosis of the COVID-19. Like the ACE receptors expression, more and more increase the viral load or viral entry to the lung and increasing the viral spread. Also, there are the chronic inflammation, which increase the pro-inflammatory cytokines and increasing the acute inflammation or acute inflammatory process. Also, there is decrease in the immune system or immune system dysfunction, so the insulin and leptin resistance present, which impairing the immune system. All over, causing severe disease and poor clinical outcome. So, in the going of the COVID-19 pandemic, clinicians should recognize that the obese and the more severely obese are at higher risk for clinical deterioration with COVID-19. As such, these people or these patients need to be carefully monitored and treated more aggressively to reduce morbidity and mortality. So, ladies and gentlemen, attention please. This is important message to help yourself and help others. Please, stop stressing and start living. Change your lifestyle. Stay active. Eat healthy, like grains, vegetables, fruits, healthy oils, milk products, meat, and beans. Also, keep the healthy food in your home. Less in salt, sugars, less sugars, less carbohydrates, and less caffeine. More in vegetables, more in fruits, more in vitamins, and more in water. And recommended you that eat to live, not live to eat. And remember that the measures or instructions for prevention of coronavirus. Use your mask, face mask, clean and disinfectant, wash your hands frequently, keep distance from others, avoid touching nose, eyes, or mouth, and stay at home when you are